I am. Good morning, everyone. I am extremely delighted to be here. First time at ZEF, and I've been following the work of ZEF for a very, very long time, right from my master's, even before my PhD. And it's just a fitting place to present some of the work that Professor Prabhu Pingali and I did, which came out in the form of a book earlier this year. And this is the topic of today's talk. So this is the cover of the book, and the book is about social protection systems in India, which we often call India's social safety nets. So what this book does, in a nutshell, is to take a tour of all the various kinds of social protection programs which were introduced in India over the course of its 75 years of independence. There have been a range of programs, and the book details into each of these programs, talks about when they were implemented, why they were implemented, what are the impacts it had, what are the ramifications it had, or unintended impacts it had. And given this perspective, what we do in this book, we talk about each of these schemes, their challenges, and especially in the future to come, where we'll see probably a different economy or a graduation of the economy into some different form. What are the potential challenges that might emerge, and how should we think about addressing them, especially in the context of why social safety nets are important? And they're important because they try to help people during times, their situations, during those times when they are not in a great situation, to achieve their full potential. It could be a health shock, it could be undernutrition during uh, childhood, it could be loss of job, or anything that one can think of. In the last few years, especially in the post-pandemic era, social protection systems have been a policy tool very much talked about globally. So these are some of the clips from The Economist, New York Times, Financial Times, and a World Bank report which came out just before the pandemic. And all these talk about how important social safety nets globally are, regardless of poor or non-poor, to make a strong system of social protection for people who may be suffering from various kinds of deprivations, which some would call bouncing back, and various kinds of things one could name. So social protection system has always existed in some form or the other across the globe. In more developed countries, they are more developed for a variety of reasons. But in the poorer countries, it becomes even more important because a large share of the population has been suffering from various deprivations. So this World Bank World Development Report 2019 talks about it, that almost 36% of the very poor could escape out of extreme poverty because of social safety net, because these are people who are most suffering from imperfect markets, various kinds of deprivation, lack of sufficient human capital, which are essential for broad-based poverty. Social protections globally cover around 2.5 billion people. And here, when I'm talking about in the context of India, things take a completely different change because they have some of the largest social protection programs in the world. So let's first just do a brief tour of what is social welfare, what is the theory and evidence around it. Broadly, social welfare programs are kind of state support in the times of risk and vulnerability against potential loss of income, livelihood, or health. In each of the countries we one lives in, there are certain kinds of social protection programs. Some are provided through employer, otherwise the government tries to come in and provide some support. Why are they important? Not only because of the economics of it, but they're also moral imperatives of social justice, because some people are just born into deprivation, and there has to be a certain social minimum that a country would aspire to for a decent life and more. It's essential for human capabilities, what Sen calls the capability based approach, and it's also important in the pursuit of self worth and dignity for every citizen of a nation. Uh, as the literature on social protection has evolved over a period of time, there's another angle that has come up, which is about the redistributive and transformative role of social protection programs. So, which makes us realize that it's so important to facilitate even economic growth through channels of productivity, greater cognitive bandwidth, consumption demand, and so forth. And we have seen this many countries, especially in the wake of pandemic, when cash transfers, a food assistance program, or other kind of support that they were provided with, it helped to bid up the consumption demand and kind of brought them back to where they were before the pandemic. Uh, In different context, one understands social protection policies differently. So there are three broad categories of what social protection involves. One is direct social assistance, the other is social insurance, and the third is labor regulation. Each of them could be subdivided into many different forms. Poor countries largely rely on social assistance, which involves direct transfers. It could be cash, food, uh, or public works program, which is very common in countries like India and Ethiopia, where people go to a government provider, be it local government. They say that we are willing to work at minimum wages, and the government gives them work, and they can work there. There are other ways of transfer, which are old age pensions, unemployment benefits, school meals in many countries like India exist, and there are early life interventions, which could be iron and folic acid, better nutrition for pregnant mothers, and early childcare. So these are the range of social protection policies which exist. What we have seen based upon our analysis that much of these policies are not static in time. For most countries going through their own structural transformation process, social protection changes in different kinds of focus, form, and scope, as we call it. And I'll tell you what do we mean by that. Generally, social protection in poor countries are just about provision of basic needs, which exists in most of the developing countries. Then they start expanding and they address other risks, which could be a job loss or a health loss. Then social protection also takes the form of promotive entrepreneur opportunities, which promotes economic opportunities through labor regulations and skill building, which becomes more important in developed countries. And overall, it leads to more transformation only when all of these things work together in unison. What also happens as the country transforms and these programs become important, they are driven by and also they drive a different kind of social contract, which we talk about or which we explain generally as the commitment that any government has towards its citizens in return for the citizenship rights of this country. So they all work in unison: the democratic deepening, the economic growth, and the expansion of social welfare program, which we have seen globally, especially starting from the European nations. And that's why if you plot GDP per capita and overall expenditure on social welfare programs, you see some of the richest countries spending most on social welfare. You see France, Finland, Italy, Sweden, Germany is here. While countries like India are somewhere here, and this is where a large part of the low and medium income countries, the low income countries here, where they not only have low GDP per capita, but also lower expenditure and overall social protection programs. While overall expenditure is one thing, it's also important to understand in terms of the graph that I showed you earlier, what are these different social protection programs that are prevalent in rich versus lower income countries. If you see low income countries mostly rely on social assistance of whatever they have. Overall, they spend less on social protection, and whatever they spend, it's mostly on social assistance compared to high income countries, which have almost an equal proportion of social insurance plus social assistance. Among the kind of social assistance provided, you see mostly in kind transfers in poor countries. So, this is to set up the stage of what kind of social protection policies are programs are available in developed countries. And I'll give you many examples of these from India, where the book is based. So, social welfare program in India, and as I told you, we'll discuss the policies and its impact and what the future looks like. There are a range of social protection programs for different kinds of risks which exist in a person's livelihood in India. If one plots a person's life cycle, starting from childbirth to their working age, uh, years, and then when they retire and go into old age. So, Government of India has different programs which include immunization, institution cash transfers for institutional childbirth. There is an integrated child development scheme under which immunization happens to young children and pregnant mothers. They're provided nutritional supplements, and also preschool supplementation happens. Then there is midday meal scheme program, where any child who goes to a public school is provided free lunch, which is to assist the deprivation which could happen because of poor nutrition, but also bring children to school, so to address classroom hunger. Why are they important? Because, of course, there are risks over a period of life cycle during the middle ages when the person is of the able age and is working, loss of livelihood, it could be lack of food, it could be lack of access to capital or investment or illness, which means different kinds of a program exist. MGNREGS is the public works program where uh, any person living in rural India is entitled to a minimum wage, provided any kind of rural works are happening in the village. So they have the right under the rights-based legislation in the country, right to work, which came about in 2006, where they can go to their village official and say, "Hey, I want to work at the minimum wage," and have to be provided 100 days of guaranteed employment. Program existing doesn't mean it work, and that's kind of one of the most important part of this book. Similarly, we have public distribution system, which is like 35 kilograms of subsidized rice and wheat at like rupees 1 kilos, which is if 80 rupees or 85 rupees is €1. So this is 1 kg of rice or wheat is provided at rupees 1, and in some states for free every month to each household. And depending on different which state of India you are living in, there's some difference, but largely 35 kilograms. Then there is a health insurance program where government subsidizes the health premium, and which is the health premium comes out to be very low. It's a program which was recently introduced. Then there is a direct cash transfer program to farmers. There is housing subsidy, and there is a livelihood support program. So these are the bunch of programs which exist for any able working person. And then for old age, in old age, there is a social pension program which is targeted to the poorer population and to the older population, which is a meager amount of money, but still there is some money which can come into their account, which ensures that the economic dependency is lessened, because in multi-generational households, which most Indian households are, it reduces the health expenses or the care expenses overall in the household. So these are the array of welfare programs that this book talks about, and we go into each of these programs, their implications for welfare. Uh, so despite having some of the largest welfare transfers in the world, poverty and vulnerability continues to be as persistent in India as it has been for a while, though of course it has come down. But poverty coming down doesn't mean people are still not less vulnerable to poverty. There is a lot of criticism of these programs, which come from the idea they're inefficient, which means the money is not well spent. There is corruption, which reduces trust in these programs, which reduces support for these programs, and then makes people think, why are they given to people? Which also means there is a negative element in terms of some calling it a handout, dole, or freebie, which kind of diminishes the potential impact that it has for poorer people, and then overall support for these welfare programs diminish. They also become words which are used often in political rallies and political campaigning, and for both in positive and negative sense, because sometimes they could become a rallying cry against those who are getting these benefits, as these beneficiaries are lazy. On the other hand, it could also become a source of political competition of your subnational head giving you more than the central government allocation of these schemes. So we talk about in this book, where has this policy wrong if we haven't achieved what we were what we were trying to achieve. It's implementation. It's probably lack of sufficiency of these programs, what they are provided, or there is an absence of overall social welfare strategy for an encompassing growth process. These are some of the numbers on around how much the government of India spends. PDS, which is the largest program, there's around 2% that's spent. But I must put a caveat here. These are numbers from the last year that was available, and this was also the pandemic year. So these overall numbers of 4.8% of GDP have come down, primarily from PDS coming down to 1% now from the latest budget, and I need to update those numbers. So overall, to understand this, you need to think this 2 to 3% of India's overall GDP goes into a range of these programs, primarily the public distribution system, the in-kind food transfer, and the rural employment guarantee programs, where every individual living in rural areas is entitled to 100 days of employment at the minimum wage. So this is the layout of the different programs that exist in the country. The contributions of this book is we are trying to create a framework to explain how social safety nets should be evaluated. And as I mentioned, the three terms that we're using, which is also part of the title of the book, is focus, form, and scope, by which We mean who are the focus, because are these programs targeted? Are these programs targeted at poor or rural areas or urban areas, or children, women, elderly? So this is very important to understand the poverty impact or welfare impact of a program. Who are they targeted towards? Because the demography shifts, the nature of the problem or the burden of poverty or ill fare changes across different beneficiaries who could be potentially targeted. So that's the focus. Form of the program could be how you give it to. It could be in-kind food transfer, it could be cash transfers, it could be old age pensions. So these are also depending on where you are on the demographic change process or structural transformation, economic change. Those things become important. So that's this focus. And the third is scope. What is the developmental scope of any program that we envisage? If just giving food is stops the idea of scope of the development intervention stops at food security, then we're probably missing something, because ultimately we want a well-nourished, a healthy citizenry. Similarly, when we look at old age pensions, if it's too low, it probably doesn't cover up even the consumption expenditure, leave alone the health expenditure. So the essential idea is that for policy to think about what impact it could have, it's important to focus on what are the form, focus, and scope of these programs. So the contribution of this book is to kind of create a framework of what it means for reducing poverty. Uh, what we do is to explain these things, do a deep down historical evolution of these programs, or what macro historical changes led to actually these programs coming in. Uh, what are the challenges that come in as the ideas of reducing poverty and underdevelopment translate to implementation on the ground? We evaluate these impacts, as I said, in terms of the scope, focus, and form. And the focus could be targeted versus universal. So these are the debates which are global debates, probably relevant for most of the developing countries, and we bring forth here in the India's context. And against this background, we envisage what are the challenges that would come up in the future when probably you have more urban workforce, and probably they are employed in more informal enterprises, when there are larger share of the children who are undernourished, or old age people who don't have formal access to pensions. So these are some of the questions that we are raising in this book. And one of the other important aspect of this book is that we say that the scope of the developmental scope of social welfare programs, if they are moved just from poverty to actually building resilience, it becomes more encompassing, and it kind of creates a more economic security system than just individual isolated social welfare programs. And why do we talk about developmental resilience? Is because poverty generally is a static uh, concept, where we're only looking at what share of population which is above and below an artificial line, which is the poverty line, while developmental resilience takes away or broadens the scope of welfare beyond poverty, uh, broadly defined as development resilience, broadly defined as just ensuring that over a period of time, individuals are not allowed to come below the threshold, whichever threshold the government or whatever researchers desire to be. It could be in terms of nutrition, it could be in terms of food security or health outcomes. So, essentially, the idea of resilience transcends beyond poverty, and also expands it to a life cycle approach, because vulnerabilities could extend across a person's life cycle, and it also is connected to the normative idea of human justice, social justice, and broad-based poverty. So, see, these are some of the ideas that we bring forth in the book, and I can talk more about it, but I guess given I have a limited time, I'll gloss over some of these things. The peculiarity of India's social welfare challenge primarily emerges from the fact that it has low human development. While poverty numbers show a decline, still it's high given the enormity of the population. And when you plot GDP per capita and human development index, or even human capital index, India is probably here, these red dots, as you can see, and it's lower than some of the other gray dots, which are the low and medium income countries. So India, which is now the largest population, most populous country in the world, has some of the most vexing challenge of underdevelopment, especially when it looked at in terms of human development and human capital index. When one tries to unpack it through various other measures of human development, it could be secondary school attendance, poverty as $1.9 and below, informal employment, So these are rankings based upon other countries, and India kind of falls in where inequality is high, poverty is low relative to other countries, but anemia is high, human capital index, it performs worse. 5% of the households have some form of saving by the end of the year. Female labor force participation is probably among the lowest in the world. So when you think about social welfare, social protection programs, these are some of the development indicators as the scope of human development, which must look at to evaluate the impact of these programs. Economy, of course, cannot be understated, and some of the challenges that India faces emerge from its peculiar, what Hans Biswanger famously called the stunted structural transformation of India. And as you can see, agriculture contributes to around 17% of GDP, but still comprises of almost more than 40% of labor shares population, which means people are still engaging in agriculture while overall agriculture GDP is coming down, which means lower productivity, and it has implications for its structural transformation from a rural to an urban economy. Poverty numbers, you can see from 1970 onwards, have come down. Recent poverty numbers show a lower number than this. But if you focus on inequality, which also shows you the difference between the bottom 50% and the middle 40%, inequality has been increasing. So that also presents a case for more redistribution, more social protection programs, because these numbers may not reflect the kind of vulnerabilities that still exist while poverty is declining in the country. So the peculiar structural transformation makes social welfare programs even more important. And the other angle that comes in here is the subnational difference in India. India, as you all know, is a vast country. It has almost 35 states. Each state are at a different stage of structural transformation, and the economic structure is vastly different. So some states which could be both as poor could have very different labor force participation in terms distribution in terms of rural, urban, or the kind of uh, employment in terms of informality, how much are they employed in manufacturing, and so on. So this is just to represent. I mean, one can talk an hour about these numbers itself, but the kind of difference in terms of sectoral share of GDP or poverty and labor force participation by state, we do see that there is a clear declining connection between per capita GDP across Indian states and any multidimensional poverty index, but they're outliers. And these outliers actually are very important to understand social protection in the country. To give you an example, Kerala versus Bihar is often example often Amartya Sen likes to give, is that the state of Kerala in southern part of India has managed to come up the Human Development Index despite not having as high of an income. So that is driven by a range of factors, social protection and strong social welfare programs, public systems, and governance systems being one of them. So, the challenge that India faces in terms of expanding its social welfare programs, in terms of improving its program implementation. So, these are some of the other challenges apart from its overall economy. There are different subnational economies, and one needs to understand. The essence of this book overall is that social welfare programs have been truly exceptional in terms of its scale, but in terms of its impact, they have achieved less than what they should have done. Their range of explanations one can give, their causal explanation one could give, their qualitative answers one could provide. Here we are doing a historical answer to it in terms of thinking, okay, we know that welfare programs exist and there are many programs, but actually, did they come about as a result of careful thought about what are the deep structural vulnerabilities? What are the causes of immediate and structural poverty problem? What are the range of actions which could be potentially undertaken and not been undertaken? So, what we do here is to plot basically when these programs came into being, the major programs that I spoke about. And this is a timeline right from 1943, when for the first time in-kind food transfers was introduced in the country. The second major program which was introduced was in Maharashtra, the state of India, where uh, famines were very common till Green Revolution made India food secure. So they introduced the first of its kind public works program. ICDS is the Child Supplementary Nutrition Program, which was introduced in 1975, but it was not scaled up to the country. It was focused on very small districts and probably didn't succeed much. Many of these programs, which are thought about in the 1950s, 60s, 70s, actually didn't work well till 2000, when the rights-based act started coming in, and they were also driven many instance by state governments, the subnational governments, taking it upon their own initiative to actually improve the performance of these programs. So if it takes over a longer duty in terms of what have been the major epochal movement of India's social protection programs, how they've shaped it up, frequent food shortages led to the in-kind food transfers. Also, they were supported by Green Revolution, which happened in India, and India had surplus food grains. And then the rights-based act, which came in through right to work, right to food, and right to education in the 2000s, were also supported in some means by greater economic strength that India had post its economic liberalization in the 1990s. But also, so that's one reason. The other is a very strong lobby of activists and civil society workers who fought for these acts, and the government of that time bought into it. So this kind of kick-started a process of more of a stronger social welfare architecture. And as you can see, much of these programs or these initiatives are bunched here since 2001 onwards. Health insurance program came in 2008. NREGA, which is your public works program, came in 2005. Hot cooked meals at schools was actually constitutionally mandated through judicial activism, where the courts pushed the idea that schools should provide, while the schemes existed on paper, because of bad quality of deaths happening in some parts of the country. So health insurance program came in 2013. Right to Food Act came in, where 75% of rural and 50% of urban population has to be covered under food assistance program. And then you have cash transfers to farmers, which is also a very new thing in India 2019. So if one thinks about a UBI or a cash transfers replacing many of these programs, this is the first large scale actually cash transfers came into being in India. There is old age social pensions program, which still remains a smaller share of the population it covers, and also the amount that it gives. But the idea is to show that a concerted thought to rapid poverty reduction or different manifestations of poverty wasn't given in India for a long time, and that's why uh, underperformance on many of these human development indicators continue. Empirical research has done a lot of analysis of these recent programs in terms of their impact on a range of indicators. I think the jury is still out, because we are still in that process where these programs are functioning, but probably not as strengthened, as entrenched into the system. So in terms of thinking about the focus, form, and scope of the program, you see various forms of programs existing with different scope, and and then focusing on different section of the population. We try to classify them into the focus, form, and scope, and also the implications in terms of, are these programs truly transformational, or these are just small provision or just preventive measures to ensure that people don't fall below that poverty line. So we do many of these classifications and talk about in each of these chapters of the book, and you have all these list of programs, the major programs. Of course, there are many programs introduced by the state governments, which are different from these, but this is the essential sense of the programs which the central government mandates and state governments in India, the subnational governments, implement. So shall we take questions as we go, or because then I can go and explain some of these programs in detail? Yeah. So I'll walk you through the public works program, which is like this picture is of a public works program where these people are working at a site in a village, where they go and there are site managers who put their names on the register. They already have a job card. They are given the number of hours they worked is counted, and they are paid money for that based on their minimum wage. This was introduced in 2006. But before these programs, many of these programs, the different forms of these programs had existed, probably on paper, different design, and they hadn't achieved what they were meant to achieve. And they started in 1978 with the Integrated Rural Development Program, where the idea is to improve agricultural productivity. And now, if you see these programs, the Public Works Program are actually wage support program. So the scope of the programs have changed in nature. The reasons are many. Principal reason why our rural development program couldn't succeed as NREGA has succeeded are two. First, this was a top-down program. Second, this was meant for our people who actually are doing agriculture, in terms of those who own a certain amount of land, because the interventions were more irrigation related intervention. So of course, a large share of the population doesn't have land, leave alone irrigation facilities. So they're still focused at not the bottom 20 or 40% of the population. And there has been evolution of the nature of program, and now NRG has kind of taken up as the main program, the public works program, and it has been supported by this NRLM, which is the National Rural Livelihood Program, which is the skilling program, because all wage workers, or most wage workers in agricultural fields, do not want to be agriculture workers for the rest of their lives or for their children. So they need to be imparted skills so they could be employable, the human capital increases, and eventually they could participate in the transformation in the economy that's happening in terms of gainful employment. So if you think of the poverty reduction programs, we have come a long way, but still NRGA has a lot of challenges. And this is why I said focus, form, and scope of these programs have changed. And the transformative effects of NRG has largely come about because it was universal, it was decentralized, it was demand driven, in terms of if I am the worker in the village, I can go and ask for work. And there is community participation because the social audits happen and everyone has a collective voice. Environmental assets in rural areas are created because the picture that you saw is probably drought proofing some part of the village or building a farm pond. It has led to greater consumption demand in the rural economy because this is a boost of income, and it has led to a feedback which is about citizen empowerment. Because if I am a rural wage worker and I know this is a program which government provides for me, then I'm also more empowered to go and ask for other programs which I'm entitled to and probably wasn't getting earlier. So overall, it leads to greater citizen participation in the economy. It leads to deepening democracy and also creates a stronger social contract. And one program feeds into the other. NRGA being a prime example, and that's what we have learned, that to make programs effective, which we couldn't do earlier, is that you need to have a universal focus. So there's no division between people of an artificial poverty line that, okay, some can get it and some don't. So there's greater political will around it. Bureaucrats are accountable, and overall entry leads to increased state capacity, which means most program work well. But when one thinks about rural livelihood challenges or livelihood challenges overall in the country, the first thing is there is a very sharp decline in the overall size of the farm in the rural areas. So this is the gray line that you see. It's for the 2016 census, agriculture census, the last which exists. Rural farm sizes are very small. 89% of Indian farm holders are classified as small and marginal. Actually, 92 by the most recent number. And here you can see that. So that's A. When you think of social protection, you need to understand these people are probably working, a large share of the population is probably working on very unviable farming sizes. The second is many of the big villages are urbanizing very fast. And when they're urbanizing, uh, most of them would be urban. And if they're urban, or at least the larger villages have more urban-like character. So public works program may not be the best idea where there's not a lot of agriculture work is happening. That's B. And then when think of urban labor, because programs exist for all kinds of labor, most of them are actually employed in informal employment, which means they do not have access to any employer-based social security. The day they are fired, next day they do not have anything to fall back upon. And COVID was the prime example where the poignant images of workers walking away from Bombay and Delhi to remote parts of the country barefoot with the children lying on suitcases and walking 50 and 500 kilometers to 1,000 kilometers was a very sad and poignant image that probably highlights this fact that most of the workers are probably earning more than any poverty line would suggest, far more, but they're still very vulnerable to being laid off any day. And so the third labor challenge is an aging population. For long, we have thought about, or we have been fed on the idea that India has a huge demographic dividend in terms of having a young population. But if you see the 2050 projection by the UN, a large share of the Indian population is going to be older. And if you imagine these people who were living with precarious employment contracts or working in informal industries, if they become old and they don't have access to any employment-based security, they're likely to be probably not retire ever, or It impinges on the overall expenditure structure of the household. And of course, health costs increasing, this is likely to have a huge effect on families or households' consumption expenditure and overall their welfare outcomes. The programs that I showed talked about, especially the livelihood program, do not talk about these risks. And then we should start thinking about what could be the programs which could address the lower farm sizes, stagnant farm income, the nature of stunted structural transformation in the country. Urbanization in India is often called subaltern urbanization, which means that cities haven't become dynamic and vibrant like we imagine cities to, but these are just really large villages where people are not working in agriculture but doing odd jobs in services industry, probably as conduits to bigger cities or something. So which means though India is getting more urbanized, doesn't have the same urban character, which means people do not have the similar economic opportunity as one would imagine in a more urbanized economy. Uh, so these are the emerging challenges of rural and so of labor actually, and social protection, thinking about labor. So these current programs need future proofing, and there are different ways they can be, which we discuss. Food assistance program, the biggest program on social welfare in India. I guess most people who work on these issues know about it, has existed for long. They have evolved in focus, form, scope over a period of time, and now with the National Food Security Act of 2013, almost every person in the country has access to PDS. But the debate now in the policy and academic circle is that is such an inefficient program where the government procures at minimum support prices from the farmers rice and wheat, then stores the same, then ships it to different parts of the country, and then distributes it through its own shops. Is that program efficient if the value chain is rife with the challenges of leakages, corruption, and inefficiencies? Though many of them have come down, but still the amount of money that goes on to it, how should we restructure it? So as you can see, from 1970 onwards, the procurement, production, and stocks of PDS has increased. Uh, while there has been a reduction in the corruption or leakages in here, has come down over a period of time, but still the challenges of this interlock production consumption incentive, which leads to huge cost and also not sufficient nutritional security, because if you give them rice and wheat, these are just calories that individuals are getting. And as I showed in earlier graph, people are less on the farm and more doing other jobs. So they also don't require the same amount of calories. Rather, they require better diets, more nutritious and healthy environment. So is this achieving nutritional security? So this is the challenge. So do we move to cash transfers? Cash transfers have their own challenges, which we discuss in this book. But this is to set the stage that we need to start very seriously thinking or engaging with the different stakeholders who are either farmers or the consumers of how to move away from this, because there are environmental costs as well. The most vexing challenge, of course, remains child nutrition and women's health in India. You have these programs here. You see a child being immunized at one of the ICDS center, and this is the midday meal scheme programs where public school kids are getting their meals, which is, of course, also calorie based, but they're at least have smarter in terms of having minimum amount of micronutrients too for children. The program is getting better, and we all know why these programs are important, because early child nutrition sets the children onto a much improved adult life in terms of income, health, and all. These are some numbers to suggest the challenges of undernutrition in India. 35%, I mean, almost one third of children in India are stunted, which is huge considering the size, the Indian children in the total size of the children population in the world. The programs are ICDS, midday meal scheme. These are programs to institutionalize or cash transfers for immunization and institutional birth. You have these programs, but just imagine them working with very little institutional capacity. So the ICDS center are manned by these women who are paid 2,500 rupees a month. They have informal contracts, and 2,500 rupees means around 30 euros. Their contracts are informal. They are overworked, they're demotivated, they're not part in the government roles. So imagine the quality of nutrition they are providing to children this, at such low payroll. So institutional capacity of ICDS is a major inhibitor to success at scale. The quality of school meals, and especially the safety and nutritive content of it, has been questioned. That's A. Second is a different challenge, which is not about social security challenge, but fundamental to this idea of school meals. Indian parents don't trust public systems, and public schools being the most important one of them. The moment an Indian parent has a little bit of income increase, they switch their children from public to private school. So, what happens in the case where you actually the quality of schooling at public schools is not great, but the social programs are focused on that. So the poor who are also going to private school, not probably the public school, they're not getting the same kind of nutritional requirements. And it's also important to understand that India's child school enrollment ratio is 100%. So every child is going to a school. They're probably not, but the learning outcomes are abysmally poor. So they're going to school, but they're not learning much. They think that if they go to a private school, they'll probably learn more. So they go to private school. So they miss the school meals program. Private schools do marginally better than public school because they're motivated by different factors. So social protection program then needs to think about where should the focus lie when you really want to improve classroom hunger as well as learning outcomes. Maternity benefits are plenty. I mean, plenty in the sense of at least relative to what they were earlier, but without adequate health infrastructure and last mile delivery concern.
We still have time at the end for questions.
Yeah. Okay. Yeah. So these are some of the challenges of it's early child nutrition program. So this is vulnerability to poverty, resilience against health shocks. So I won't go into this. I'll actually summarize. This largely shows the lack of access to healthcare infrastructure, which I was kind of belaboring in my earlier point. India is one of the lowest per person or per thousand people hospital beds, nurses, midwives, and physicians. So imagine any health insurance program working well here. So I will summarize. I won't go over this. So I'll stop here as why does India's welfare regime, or I mean, not even a welfare regime, whatever welfare programs achieve less than what they were intended to. First, we say that the social contract is feeble. It's not strong enough in terms of government committing to the welfare of the poor. Whatever has increased recently still remains not structured and well developed enough. The second is the ability or the organizational capacity of the government, which is generally we term as state capacity, to identify and deliver welfare remains weak, which could be a result of a range of things, including lead capture, local institutions being adverse to citizen-state relationship and bureaucratic inefficiencies and overall weak public system. As I talked about the school system, if school quality remains poor, then how much are school meals going to be effective, or in the absence of quality healthcare infrastructure, how much is a social subsidized healthcare provision going to improve financial inclusion, improve out-of-pocket health expenditure in the absence of inefficient grievance redressal. So I'll stop here. I won't go to the contemporary debates about cash transfers and technological solutions for last mile delivery. So I will stop here. Yeah. So this is how we want to imagine a resilient system where over the period of life cycle, much of these risks are addressed, but also there are institutional enablers, which includes economic growth, access to credit, transport infrastructure, water sanitation, and all the kinds of strong public systems which are essential for any kind of government support that's being provided. So I'll stop here. Thank you.